Welcome back to the Healthcare Nurses Network podcast, where nurses connect, communicate, and collaborate to drive better patient care. This is episode 2 of our 10-part series on case management, and today, we're shining a spotlight on a group of healthcare professionals who often go unnoticed but play a pivotal role in transforming patient care and hospital efficiency. Nurse case managers. You may have worked alongside them, but do you truly understand the scope of their work and the impact they have? These professionals are far more than resource coordinators. They are advocates, problem solvers, and the backbone of a well-coordinated healthcare system. They ensure that patients receive the right care, at the right time, in the right setting, while supporting nurses, physicians, and hospital administrators in delivering seamless, high-quality care. Today, our hosts, James Carter, BSN, RN, an ICU nurse with first-hand experience in high-acuity patient care, and Emily Ramirez, MSN, RN, a dedicated nurse manager, will discuss an insightful article written by Dr. Nicholas Abella, entitled Nurse Case Managers, the Healthcare Heroes You Did Not Know About. His research highlights the often overlooked role of nurse case managers and how they improve patient outcomes, enhance care coordination, and drive hospital efficiency. In this episode, we'll explore the critical role of nurse case managers in improving patient care and reducing costs, how nurses can expand their influence beyond direct bedside care, the importance of collaboration in healthcare and the power of multidisciplinary teamwork. And as always, we'll leave you with a practical takeaway: start building your multidisciplinary network today by connecting with a healthcare provider outside of your immediate team. Are you ready to rethink case management and see how it can transform your practice? Let's get started.
Welcome back to the Healthcare Nurses Network podcast. You know, we're all about empowering nurses with insights, strategies, and real-world solutions to thrive right.
Absolutely.
And today, we're diving deep into something that I think is close to every nurse's heart:
Okay.
how to provide truly holistic patient care, even when it feels like we're juggling a million things at once.
It's a challenge we all face
Huge challenge.
every day.
So what insights do we have for this deep dive?
Well, I think the key here is really about integrating the principles of nurse case management. Have you heard of those amazing nurses? The ones who just seem to effortlessly coordinate everything for their patients, making sure they have all the resources and support they need even after they leave the hospital.
Yeah, they're like miracle workers.
They are, and that's the magic of case management, you know? It's really about going beyond just the immediate medical needs and looking at the whole picture.
I love that. And the best part is, you don't need some fancy certification or a special job title to make this kind of impact. Every nurse, I mean it, every single nurse can be a case manager.
You got it. Regardless of their role or their setting.
I'm already getting excited. This is good stuff.
I know, it is.
Okay, let's talk results. What kind of results are we talking about here?
So have you ever heard about these hospitals with these amazing nurse case management programs? They see some pretty incredible reductions in readmission rates, especially for those tough chronic conditions.
Okay, give me an example. Like what?
Think congestive heart failure.
Okay, yeah, that's a big one.
Big one. Hey, so lower readmissions, what does that mean? Better patient outcomes?
Obviously.
Less strain on our healthcare system?
Okay, that's a huge win right there.
Absolutely a win.
But let's get practical for a minute, because I know our listeners are probably thinking, how can nurses who are already stretched thin, I mean, we're talking really stretched, actually integrate case management into their daily crazy routine?
I hear you. That's a real concern, but think of it this way, okay? Every single interaction that you have with a patient, that is an opportunity to practice case management. Let's go back to that congestive heart failure patient, all right? Now you're laser focused on getting their medication stabilized, right?
Right. That's priority number one.
Of course. But a true case manager also thinks about what happens when that patient walks out of the hospital doors.
What do you mean? Like, are they going to follow those dietary restrictions?
Exactly.
Will they actually go to those follow-up appointments?
Yes, you're getting it.
Are they connected with support groups? Like, do they even know about community resources that can help them?
Exactly. It's about addressing that whole patient, not just the immediate medical needs, you know?
I love that. Holistic care. That's what we're all about.
It is. And luckily, our source material for today emphasizes this whole approach really well. There's a whole section. It's called If No Case Manager is Available. And it lays out practical steps any nurse can take.
Okay, I am loving this. It's like a roadmap for nurses to take charge, even when things get tough.
It is.
And speaking of resources, everyone listening, you've got to check out healthcarenurses.net.
Oh, yeah.
You'll find all kinds of goodies there.
I was just about to say that
Yeah.
there's this amazing case management checklist that's designed specifically for nurses who want to use these principles, and it's fantastic.
Perfect. Now, you mentioned earlier those hospitals that have dedicated case managers see amazing results.
Yeah.
But what about nurses who work in places, maybe smaller hospitals or departments, where they just don't have those resources?
Okay.
Are they out of luck?
Absolutely not. Even in a small hospital, rural setting, department without a dedicated case manager, nurses, they can still be incredible advocates for their patients.
So it's about getting a little creative.
It is.
Resourceful, thinking outside the box.
Absolutely. Let's say, okay, you have this patient who really needs transportation to a follow-up appointment, right?
Okay.
But there's no system in place to arrange that. Now, a nurse with a case management mindset, they might reach out to local community organizations or maybe even collaborate with the hospital social worker.
That's such a great example of how we as nurses can really step up and fill those gaps when the system, isn't perfect.
And I bet those little acts of advocacy, they probably have a huge impact on patient outcomes.
Absolutely.
Yeah.
You're preventing a potential complication or readmission down the line. It's a win for everyone.
It is.
Okay, but I'm going to play devil's advocate here for a second.
Okay.
I think one of the biggest concerns that nurses have is that case management, it just sounds like extra work.
Yeah.
On top of an already impossible schedule. How do you address that?
Yeah, I get it. It's completely understandable.
Yeah.
But the beauty of case management is it's not about adding more to your plate. It's about working smarter, not harder. It's about using what you already have.
So less about taking on new tasks, more about shifting your mindset.
You got it. Instead of just focusing on those immediate tasks, you're thinking about that bigger picture.
Okay.
The patient's journey beyond the hospital.
Okay. So this is all very inspiring.
It is.
I want to dig in a little deeper now.
Okay.
Let's talk about specific things that nurses in different roles can do to really implement these principles.
Okay.
Let's start with nurse leaders.
Okay.
How can they foster this whole case management mindset within their teams?
Well, I think, first of all, you have to recognize the skills and contributions of every single nurse. It doesn't matter what their title is.
Okay.
Nurse leaders, they can create a culture where all nurses feel empowered to act as case managers.
Yeah, where it's not someone else's job, it's everyone's responsibility.
Exactly.
Okay. So how can we empower nurses to embrace this?
Training on discharge planning is huge. Educating them about community resources. Encourage them to be proactive advocates for their patients.
Love it. Okay.
Yeah.
So by investing in their teams, nurse leaders create a ripple effect. Better for the patients, better for the healthcare system.
Exactly.
Now, let's talk money. Healthcare costs, always a hot topic. How does a case management approach save money?
Okay, so think about it, right? We're preventing complications, reducing readmissions. We're making sure patients are getting the right care at the right time. We can significantly lower those healthcare costs.
Okay, so it's a smart investment, not just for patient care, but financially too.
Exactly. And this whole thing aligns so perfectly with this whole shift toward value-based care.
What's that?
Okay, so it rewards providers for, delivering high-quality care, improves outcomes, reduces costs. Nurse case managers, they're key players in this shift because they get it. They understand the patient's needs. They can coordinate care across all these different settings and providers.
So in a way, we're kind of connecting the dots here between individual patient care and the bigger picture of the healthcare system.
Yep.
Okay. Before we move on, we've got to talk about resources.
Resources, so important.
We can't emphasize enough how valuable resources like healthcarenurses.net can be.
Absolutely.
For nurses looking to really put these case management principles into practice. The site's got practical tools, guidance, support to help you every step of the way.
It does.
So whether you're a seasoned nurse or just starting out, there's something there for everyone. Now let's talk about how to integrate this approach into different nursing roles. Let's start with bedside nurses. They're on the front lines, right? Interacting with patients throughout their stay. How can they weave case management into their daily routine?
I love this question because think about it. Every interaction with a patient is a chance to practice case management. It's not about separate tasks. It's a mindset shift that changes everything you do.
So a bedside nurse can act as a case manager Just by, say, making sure the patient understands those discharge instructions.
Absolutely. Or helping them schedule follow-up appointments.
Connecting their families with services in the community.
Exactly.
Those little things, they can make a world of difference.
They can. It's about seeing the patient as a whole person, not just symptoms or a diagnosis.
Yeah.
Proactively addressing their needs throughout their journey.
This is all so insightful. But what about those nurses who work in places where there just aren't dedicated case managers? Do these principles still apply?
Of course they do. Even in small hospitals, rural areas, departments without a dedicated case manager, nurses can still take on some of that role.
So give me an example. How would that work in practice?
Let's say a patient needs a ride to a follow-up appointment.
Okay.
In a setting without a dedicated case manager, a bedside nurse might just step in, help arrange transportation,
So being resourceful, collaborating with whoever's available.
Exactly. This could mean working closely with social workers, maybe reaching out to community organizations, or just being a strong advocate within the healthcare team.
It's really amazing how much impact a nurse can have, even in a system that doesn't have those formal case management structures in place.
It's a good point. These principles of case management, they're adaptable and they can be applied anywhere by any nurse. It truly empowers every nurse to be a change maker.
Okay, but I have to ask.
Yeah.
Putting all of this into practice, it can feel overwhelming.
Yeah.
Where can nurses go for support and guidance as they start to, try to embrace these principles?
Well, we talked about healthcarenurses.net.
Great resource.
It's fantastic. But honestly, talk to your colleagues. Share best practices. Learn from each other.
Building that network of support.
It's so important. Don't underestimate the power of baby steps.
Okay, like what? What's a baby step?
Start by figuring out one area where you can improve care coordination. Maybe it's just setting up a follow-up phone call with a patient after their discharge.
Simple but effective.
Exactly. By focusing on small, achievable changes, nurses can build momentum and gradually integrate case management into what they do every day.
It's like a snowball effect, right?
It is.
Small actions lead to bigger changes, and eventually we create a healthcare environment where every nurse embodies these principles.
That's the dream.
Okay, we've covered a lot of ground here, from the core principles to how nurses in different roles can actually make it happen.
We have.
What stands out to you as the most important takeaway for our listeners?
Every nurse, and I mean every nurse, has the potential to be a case manager.
Yeah, it's not about the title.
It's not about the role.
It's a mindset.
It's a mindset.
A way of approaching care.
Exactly.
That goes beyond just the clinical stuff and sees the whole person.
And studies have shown that this whole proactive discharge planning and follow-up, it can reduce readmissions for certain conditions by as much as 20%.
Wow. Okay, so we're not just talking about feel-good stuff here. We're talking about real results.
Absolutely. And it all comes from recognizing that what we do as nurses, it has a ripple effect that goes way beyond that immediate care we provide.
It's so empowering to know that no matter where we work, what our title is, we have the power to make a real difference.
You do. And by adopting these principles, we not only improve outcomes for our patients, but it makes our work more fulfilling.
And more collaborative.
Right. Absolutely. A win-win.
Okay, I want to leave our listeners with something to think about.
Okay.
What is one small change you can make today to incorporate case management into your own practice?
Yeah.
Maybe asking a patient about their support system at home, making sure they understand those medication instructions.
Such a good point.
Little things.
Little things make a big difference.
They really do.
And remember, even those small actions, they contribute to a healthcare system that's more patient-centered, more efficient, and more compassionate.
Well said. And for those who want to keep learning, dive deeper, you've got to visit healthcarenurses.net. It's packed with resources.
Checklists, guidance on all the relevant standards, tips for creating those effective care plans. It's your one-stop shop.
Become a case management superstar.
Okay.
Now, for a real-world example of how powerful even a small act of case management can be.
All right, picture this.
Okay.
A small rural hospital, resources are thin.
Okay.
No dedicated case manager on staff. A patient is getting ready to be discharged after a really rough time.
Okay.
But there's a problem. They don't have a way to get to their follow-up appointment.
Oh, no. Okay. I feel like so many nurses have been in this situation. They want what's best, but there are all these systemic barriers. So what happened?
Well, this is where a bedside nurse, armed with that case management mindset, steps up. They don't just like hand the patient discharge papers and say good luck. They see this potential obstacle and they do something about it.
Okay, what do they do?
They got creative. They started reaching out to community organizations, collaborated with the hospital social worker. They really explored all their options.
Love it.
And guess what? They found a way to get that patient transportation so they didn't miss that crucial follow-up care.
That's amazing.
It is.
It really shows how much a nurse can do.
It does. Even without the formal training or the specific job title, just by being proactive, being resourceful.
So inspiring.
It is.
It shows those case management principles. They can really be applied anywhere by any nurse to make things better for the patient.
Absolutely.
That wraps up part 1 of our deep dive into nurse case management.
We'll continue the conversation in part 2, where we'll explore more practical strategies and real-world examples of how nurses like you can truly make a difference. So stay tuned.
Don't forget to visit healthcarenurses.net for tons of resources and support. We'll be back soon with more insights on the Healthcare Nurses Network podcast.
We will. Welcome back to part 2 of our deep dive into nurse case management. Before there, we were discussing a compelling case where a nurse went above and beyond to arrange transportation for a patient's follow-up appointment.
Yeah, that story really stuck with me.
It's powerful, right?
It is. It shows how even those small actions can create this ripple effect, ultimately impacting the patient's recovery, their well-being, and it all comes back to recognizing those social determinants of health, the things that often get overlooked.
Absolutely. Now let's shift gears a bit and focus on the individual nurse.
Okay.
We've talked about how case management impacts the system as a whole,
Mm-hmm.
but what about the benefits for nurses in their everyday work?
Yeah.
How can these principles make a difference when you're in the thick of it, dealing with the chaos?
Right, because that's the reality for so many nurses out there. It's a valid concern, especially when we think about how demanding nursing already is. Burnout's a huge issue.
It is.
And we certainly don't want to add to that burden. But maybe case management could actually help with that.
You're hitting on something really important here. One of the biggest benefits of this approach is the sense of empowerment it brings. Nurses who really embrace that case management mindset.
Mm-hmm.
They're not just reacting to problems, they're becoming proactive problem solvers, advocates for their patients.
That's a powerful shift, going from feeling overwhelmed to feeling empowered.
It is.
That could be transformative, really.
Yeah.
I imagine it also helps build stronger relationships with patients, more trust, better rapport.
Absolutely. It's about going beyond just treating the illness.
Yeah.
It's about caring for the whole person. And when you do that, it can lead to more job satisfaction, less burnout, a stronger sense of purpose.
It sounds like a win-win-win situation here.
It is.
Nurses feel more fulfilled, patients get better care, and the whole healthcare system operates more efficiently. But I think the big question is, where do you even begin?
Right.
How do you actually start to integrate these principles? It can feel pretty daunting to change your whole approach, especially when you're already juggling so much.
It's true. Change can be tough. But the key is to remember, embracing case management is not about doing everything at once. It's a journey. Start small. Pick one area where you can make a difference.
Okay, so what could that look like? Could it be something as simple as spending a few extra minutes with a patient to make sure they really understand those discharge instructions?
Absolutely.
Or maybe connecting them with a community resource, just something to give them a little extra support.
Exactly. Those small actions, they add up. Don't underestimate the power of those little moments. And remember, you don't have to do it alone. There are resources out there, both online and within your own organization.
Speaking of resources, I've got to give another shout out to healthcarenurses.net.
Of course.
It's such a valuable resource for nurses who want to implement these principles. You'll find checklists, guidance on those relevant standards, even tips for creating effective care plans. It's a great place to start.
It is. And don't forget the power of connecting with your colleagues. Talk to each other, share those best practices, learn from each other's experiences, build that network of support.
Absolutely. Fostering that culture of collaboration, shared learning, that's where the magic happens. We can all work together to provide the best possible care. Okay, I'm ready for a story.
Okay.
Let's hear a case study that shows nurse case management in action.
All right, I've got a good one. This one really shows how, even in a resource-constrained environment, nurses can make a huge difference.
Okay.
So imagine you're in a busy cardiac unit. Nurses are running around. They're juggling patients with complex needs.
Mm-hmm. Sounds familiar.
Right. And there's no dedicated case manager. Time is precious.
Okay, that's a scenario that I think a lot of nurses can relate to. The pressure's on, and it's hard to see beyond those immediate tasks in front of you.
Exactly. But one nurse on this unit had a patient who was recovering from a heart attack. And while she was focused on his medical recovery, she also took the time to really understand his home situation.
So she's looking beyond those physical symptoms, trying to get a sense of his life, his support system outside the hospital.
Exactly. And it turns out this patient lived alone, he had limited mobility, and relied on public transportation. And she realized, those factors could really affect his ability to attend follow-up appointments, to manage his medications properly.
So even though he was medically stable enough to be discharged, she saw a potential roadblock to his long-term recovery.
You got it. And that's where her case management mindset kicked in. Instead of just handing him those discharge papers and sending him on his way, she decided to connect him with a social worker.
That's a smart move. The social worker probably had access to a whole range of resources and information that she might not have known about.
Exactly. So they worked together, explored options for home healthcare support, looked into transportation assistance, even contacted the patient's local pharmacy to see about setting up medication delivery.
So it was a real team effort going above and beyond to meet this patient's needs.
Absolutely. And the results speak for themselves. This patient, who might have struggled to manage his recovery on his own, he got the support he needed. He was able to stick to his treatment plan, and that reduced his risk of being readmitted to the hospital.
Wow, that's amazing.
It is.
It's proof that being proactive and taking those extra steps to address those social determinants of health can make a huge difference.
And it all started with one nurse who embraced that case management approach. She saw the whole person, not just a set of symptoms, and she took action to advocate for his needs beyond the hospital.
Such an inspiring story.
It is.
It really shows how even without a formal case management structure in place, nurses can change the game.
Absolutely. We'll be back after a short break to wrap up our dope dive into nurse case management. Make sure to stick around. We've got some inspiring closing thoughts to share with you.
Welcome back to the Healthcare Nurses Network podcast. It's been really amazing to explore this whole idea of nurse case management.
It has.
And you know what? It's becoming so clear that every nurse, even without that official title, can be an amazing patient advocate.
Absolutely.
We were just talking about this incredible case study, the nurse who went above and beyond to make sure that heart attack patient had the support he needed after he was discharged.
Yeah.
It's such a good reminder that those social determinants of health, they can really make or break a patient's recovery.
They really can. And it all comes back to a change in perspective. That nurse didn't just see a patient with a medical condition. She saw a person, a whole person with a life outside of the hospital, a person who might need a little help along the way.
And that's what nurse case management is all about, isn't it? Seeing the whole picture, understanding each person's needs, and then advocating for their well-being throughout that entire healthcare journey.
Exactly. And the best part is this approach can be used anywhere, in any nursing role. Whether you're at the bedside, a nurse leader, working in a community clinic, you can make a difference.
So what's one thing our listeners can do, like today, to start using these case management principles in their own work?
Think about your patients. Are there any potential challenges they might face once they're no longer under your care? Maybe it's transportation to appointments, understanding their meds, or maybe they don't have much support at home.
Yeah, those are all really crucial factors that can affect how well a patient recovers.
They are. So take a few minutes to ask some extra questions. Maybe connect with other members of the healthcare team, or even look into resources in the community.
It's about thinking ahead, being proactive, and really advocating for those needs that go beyond the immediate medical stuff.
And don't forget, even little things can make a big difference. A quick phone call to check in on a patient after they've been discharged, or maybe connecting them with a local support group. These things can have a lasting impact on how they're doing.
This has been such a great conversation, and I really hope everyone listening is feeling inspired to embrace their inner case manager.
Me too. We've just scratched the surface, but keep learning, keep exploring.
And you know where to go for a ton of resources. healthcarenurses.net.
All the checklists, guidance, tips for creating those care plans. It's all right there waiting for you.
Become a case management rock star. Thank you for joining us on this deep dive into nurse case management. Remember, you have the power to truly make a difference in your patients' lives. Embrace that case manager within you and let the magic happen.
Thank you for listening to the Healthcare Nurses Network podcast.